We're in a third resurgence in Canada with cases increasing.
Canada's top doctor using social media to share her warnings and advice on COVID-19. In a half-hour Facebook session, Dr. Teresa Tam took questions from Canadians. Top the list, ever-changing advice on vaccines.
I think the fundamental challenge with this pandemic is that science and evidence and knowledge is always evolving and is emerging fast. So we have to act fast to adapt and evolve the guidance.
On Monday, Canada's National Advisory Committee on Immunization changing gears on the AstraZeneca vaccine, not recommending it for people under 55 after reports of blood clots in Europe.
But as more and more vaccines are rolled out in real life to tens of millions of people, more data is going to come in.
Since the beginning of the pandemic, government officials have been working to provide Canadians with daily COVID updates while also trying to dispel misinformation. It's a chance to address misinformation that is often found on social media and explain the attack plan directly to Canadians. Questions like, what vaccine is best?
It's really difficult to compare vaccines because they weren't studied in what we call head-to-head trials. So in one trial, at the same time, designed the same way, you compare one vaccine to another.
Officials maintain Canadians should take the first vaccine that is offered. In terms of the vaccine rollout, official clarified why many Indigenous Canadians are able to access vaccines before others.
Indigenous people still have the worst health of any ethnic group in the country, and they carry a disproportionate burden of chronic diseases. They have a lower life expectancy. And because of where they live, often in remote and rural locations.
Health officials hitting social media as Canada sees a surge in cases right before the Easter weekend. In Ottawa, Nigel Newlove, City News.